Learn the fundamental concepts of trauma and orthopedic X-rays from the experienced faculty of Orthopaedic Academy. Gain a comprehensive understanding of normal radiological MSK anatomy, traumatic conditions, and elective conditions in this comprehensive course. Learn the discovery of X-rays by Wilhelm Röntgen in 1895 while working with high-energy electrons in vacuum tubes. Explore the image intensifier, an X-ray source used in the generation of X-ray images. Understand the concept of X-ray penetration and its significance in obtaining clear and detailed X-ray images. Learn how to effectively describe X-rays, including the radiograph type, demographics, visibility of adjacent joints, and potential diagnoses. Discover the importance of classifications in X-rays, including bone, joint, pathology, age, and potential implications for management. Gain insights into the key elements to consider when describing fractures, such as location, pattern, alignment, joint involvement, bone quality, and soft tissue observations. Understand the significance of fracture location in the epiphysis, metaphysis, and diaphysis, proximal, middle, or distal. The course is designed to enhance attendees' comprehension of both normal and pathological presentations in orthopedic radiology. Upon completion of the course, participants will possess the expertise required to identify and explain important radiographic measurements pertaining to the upper and lower limbs as well as the spine. Join us now.